To find the implant that's right for you, a careful physical examination is required to determine what is technically possible on your frame, and then to make sure that this is adjusted to precisely match the look you're after. Now, one of the key variables of an implant is its width. So when it comes to finding the implant size for you, the diameter of your breast footprint, or your breast base width being another term, is the maximum implant width we can choose. Of course, this is adjusted a little depending on how much cleavage and how much side boob is wanted. Now, the implants on my desk are all organised based on the implant width, with the number on the front of my desk referring to the diameter in centimetres. So for example, if someone has a breast base width of 13 centimetres, then technically this is as far as we can go with regards to our implant selection. Choosing an implant beyond this point is technically not possible for that person's frame. The other issue with implants is their profile, or how far forward they project. Implants on my desk are also arranged in rows based on their profile. These are all moderate profile, these are all high, otherwise known as full profile, and these are all extra high, otherwise known as extra full profile. Now, if we look at these particular implants, these are all 13 centimetre diameter implants, but they all vary based on their profiles, moderate, high, and extra high. Of course, for any given volume of implant, the projection of one implant brand may be labelled as high profile, but for a different brand, that same level of projection may in fact be called an extra high profile. So yes, it can get very confusing at times. Also, for those wanting an extra large full look, but have a limited breast base diameter, then certain brands of implants come with a much narrower diameter for very large volumes. These particular implants are both 800cc implants, but they differ based on their diameter. This is a broader diameter, still quite full. This is a much narrower diameter and therefore very full, but they're both labelled extra high profile implants. Now, when it comes time to the anatomical or the teardrop implants, these issues with regards to the variable widths and profiles are exactly the same. Of course, the shape is very different, with the bulk of the volume down the lower half of the implant with a gentler taper at the top half. This helps create a far more natural look in those wanting that, without that upper pole fullness that is achieved with some of the rounder implants. The only additional variable with a teardrop implant is the breast base height, because some brands of anatomical implants have heights which differ from their widths. That is, they have an oval shaped base and not a round base. So measuring the breast base height is also important when assessing someone's frame. Now, in the end, an experienced and skilled surgeon will know exactly what's going to work for you.